Hi, I'm Randall Milheiser with RUS Telecom Division. I'm here to present the Opioid Distance Learning and Telemedicine Grant Program for fiscal year 2019. Program purpose. The program provides or improves distance learning and/or telemedicine services in rural America by funding equipment that allows rural residents to access distance learning or telemedicine services from hub sites located in larger urban or suburban areas. This has the effect of overcoming the effects of remoteness and low population density. Distance learning. Distance learning means the synchronous delivery of curriculum via telecommunications and promotes the connection of students and teachers at remote sites. It provides educational programs, instructions, or information originating in one area, whether rural or not, to students and teachers who are located in rural areas, or to connect teachers and students located in one rural area with teachers and students that are located in a different rural area. The key here of distance learning is always the synchronous delivery. We want to emulate real-time delivery as much as possible to simulate face-to-face communication. Telemedicine. Telemedicine is a synchronous telecommunications link to an end user from medical professionals at separate sites in order to exchange healthcare information for the purpose of providing improved healthcare services to residents of rural areas. Telemedicine shows benefits to rural areas either in reduced travel or improved access to service. Again, the key here is synchronous communication. The idea is to provide real-time interaction between doctors and patients, for doctors at the hub sites, patients at the end user sites, or doctor to doctor if necessary between hub sites and end user sites. These are some statistics from last year, 2018, $29 million available for 2018, and $10 million additional dollars were made for addressing the opioid epidemic in rural America. In 2019, the traditional amount has not been established yet, but there will be, we do have $10 million for this particular program here that we're talking about today for the opioid-funded DLT program. Some basics of the grant program is you are required to have a 15% match. The minimum grant amount is $50,000. The maximum grant amount is $500,000. Only grants are available, no loans or combo loaning grants. Last year, as you can see from the slide, we had 224 applications received by June 4th, 132 applications approved for $40.8 million, 67 distance learning awards, 65 telemedicine, 849 sites on the distance learning, 758 sites on the telemedicine. Distance learning covered 32 states, and telemedicine 39 states, distance learning 22.7 million, and telemedicine 18.1 million. So last year we carried STEM and opioid special consideration. There were 63 STEM projects for 17.9 million and 51 opioid projects for 18.6 million. And then there were some that did not have special consideration at all, 18. So there was 4.4 million. So in 2019, the full was released, funding opportunity announcement was released on February 14th. The opioid DLT, which we're talking about now, it has a deadline of April 15th. And there is the traditional DLT program, which will be covered in a later webinar, which will close at May 15th. Okay, for the opioid DLT grant program, the scoring is a little different than the traditional DLT. There are 4 scoring categories, 3 objective and 1 subjective, with a maximum of 145 points. The rurality, you can score up to 30 points, with a minimum of 15 points required to be eligible. Economic need, you will score up to 30 points. Special consideration, you can score up to 30 points, and we will cover this later. This is, you get 5 additional points for each end-user site that you have in the 220 CDC identified at-risk counties. And then we have the subjective, which is the needs and benefits, up to 55 points. And then notice we put this in the changes for on this slide, changes for the program application guide. In section J, the applicants must provide acceptable evidence of legal existence along with SAM.gov printout. So we've sort of beefed up the section J requirements so that we can more easily identify and verify the legal standing of the applicant. Project purpose. Only applications with opioid treatment as the primary purpose will be considered during this funding period. Again, let me reiterate that this is an opioid-specific DLT grant program, and that there is a traditional DLT program that opens simultaneously but will close a month later. And that information is on our website, and there will be additional webinars. Minimum grant purpose, 50,000. Grant request is 50,000. Maximum grant request is 500,000. Environmental questionnaire, environmental requirements for broadband facilities. A complete project description of all aspects. Be very clear of all aspects of the projects. Are equipment purchases or within existing facilities. The project location and where broadband facility is proposed. There is a contact here if you need to contact somebody regarding the environmental aspects of your application. This was the broadband facilities were made allowable last year. It is restricted to 20% of your grant amount, but you can use that money if you need to run fiber, but there are some specific requirements and constraints on the broadband facilities. It is covered in the application guide. Applicant assistance. Prior to the official submission of applications, applicants may request technical assistance or other application guidance from RUS as long as such requests are made 15 days prior to the final application due date. Applicant eligibility. The following entity types are eligible to apply: incorporated organization, Indian tribe or tribal organization as defined at 25 USC 450BE, state or local unit of government, a consortium as defined in 1734.3, or other legal entity including a private corporation organized on a for-profit or not-for-profit basis. Consortium. Every year we get consortiums that apply, and consortiums can fall into several different categories. A consortium is a combination or group of entities formed to undertake the purposes for which the distance learning and telemedicine financial assistance is provided. If the applicant is an existing established consortium with the legal ability to contract with the federal government, that organization can apply in the name of the formal consortium. So that one's the easiest. If the applicant is an informal consortium, which by itself lacks the legal capacity to contract, the consortium must have a fiscal agent from the consortium apply on its behalf. If awarded, one of the following will be required. A fiscal agent from the consortium may assume sole responsibility and contract with the RUS and all awardee responsibilities. Will be the lead entity, if you will, signing all grant documents and being responsible for implementation of the grant. Or if you don't want to go that route, then each individual entity must contract with RUS on its own behalf, confirm legal existence and authority, and each entity of the informal consortium must sign grant documents. That is probably the most complex one, which requires all the entities to sign all the documents and be responsible equally. Categories of eligible grant purposes. Acquiring by lease or purchase eligible equipment. If leased, the cost of the lease during the 3-year life of the grant is eligible. The grant period is for 3 years, and the grant period starts on the date of your grant agreement. Constructing broadband facilities to serve DLT purposes. Costs may not exceed 20% of the grant amount. Applicant must own the facilities. So that gets a little tricky. If you build the facilities, if you're a school or clinic and you build the facilities, then you must own them after completion. You can't turn them over to your local ISP. Acquire an instructional program, and that is a capital asset. This includes the purchase or lease of instructional programming already on the market. Just remember, this program must be a capital asset, and it must be purchased from a third party. You can't pay an on-staff person to develop the instructional programming. And providing technical assistance and instruction for using eligible equipment. The cost of this category cannot exceed 10% of the grant amount requested. So be aware of that when you're building your budget. Ineligible purposes. To pay for medical educational equipment not having telemedicine or distance learning as its essential function. To pay for electronic medical record systems. Medical equipment not used is primarily for telemedicine and primarily is defined as 50% or more. We will not pay for salaries or administrative expenses, including recurring broadband connection fees. So we can't pay you a monthly internet fee. We do not pay for application preparation costs, and we do not pay for purchase of land, buildings, building construction, site development, or destruction or alterations of buildings. These are examples of eligible equipment: computer hardware, software, computer network components, data terminal equipment, inside wiring, audio and video equipment, telecommunication terminal equipment, interactive audio video equipment, broadband facilities, if owned by the applicant. The application must demonstrate that the predominant purpose, 50% or more of use of every line item in the grant, and match budget meets the DLT grant definition of distance learning and or telemedicine. So we went over this on a previous slide. All equipment must be new and non-depreciated. So you can't install equipment that's been in your something that you've had for 2 or 3 years, and it's not new. We only pay for brand new equipment. Matching contribution. The grant applicant's minimum matching contribution must equal 15% of the grant amount requested and be used for eligible grant purposes. So just a note that the matching equipment or that you buy must also meet the eligible grant purposes. So it can't be, again, it can't be for salaries or administrative expense. There are special matching provisions for American Samoa, Guam, Virgin Islands, and the Northern Mariana Islands. It's covered in the application guide, and matching contributions cannot include financial assistance from federal sources unless there's a federal statutory exception. This simply means that you cannot use grant funds from other federal sources as match unless the grant funds specifically state that those funds can be used for distance learning and telemedicine match. So there are only very few instances of those. So be sure you read the language of that grant carefully if you plan to use that. Matching contribution 15% required. Matching funds can either be cash or equipment used for the project. It may be in-kind contributions from a third party. Matching funds must be used for a purpose that would be otherwise eligible for grant funding. We've spoken on this on the previous slide. The value of in-kind contribution must be supported, so you must demonstrate an invoice for some support of the cost of the equipment. Vendor discounts or supplied equipment is not an eligible in-kind contribution. Only new equipment may be used. Donation or use of partially or fully depreciated equipment are not allowable. Rurality, objective criteria. This criteria measures the rural benefit. The minimum score threshold for eligible application is 15 points. This category is based on the census data of up to 30 points. Now this is, we addressed in the application guide on how to determine your rurality score. There's a Rurality Worksheet provided and instructions on how to get your rurality census data from the 2010 census, and all that's provided in the appendix of the application guide. Economic need. Economic need is measured by the latest county SAPE poverty percentage, all ages data found in the U.S. Census SAPE data. This criterion will be used to evaluate the relative financial need of the applicant, community, and project. Applicants are required to provide the applicable SAPE percentage based on the county where the hub and end user sites, as defined in 1734-3, are located, where the end user sites are located, and this can be up to 30 points. Hub end users and end user sites located within geographic areas for which no SAPE data exists will be determined to have an average of SAPE poverty percentage of 30%. This applies to the Pacific Islands, Guam, Northern Mariana Islands, and areas where there is no SAPE census data. Special consideration. Applications will receive 5 additional points for each hub, end user, or end user site that is located within the 220 at-risk counties identified by the CDC. The at-risk counties are listed below. They're available in the application guide and on the CDC website. The maximum number of points available in this category is 30. But applicants are encouraged to connect as many sites in the at-risk counties as possible. There is a list in the application guide. The subjective category need for services and project benefits. This criteria compares the specific needs for the technology in the proposed service territory and how the proposed project will address those needs and benefit the residents of the affected area, up to 55 points. So the subjective criteria on the opioid DLT is a little more in detail. And specifically, we're asking, we're seeking applications that use DLT technologies to facilitate the following opioid-related services: specialized medical, dental, psychiatric, or pharmaceutical services, group counseling or other peer support services, family therapy and support services, home monitoring applications to support patients in between medical visits, school-based or community-based health centers, peer-to-peer or mentor-led training between workers of the same professional sector or across sectors, that is nurse to nurse, judge to judge, teacher to teacher, etc. Advanced training classes or virtual clinics led by specialty care providers to train primary or rural care providers. Recovery support or workforce training for people with substance use disorder. So when you're doing your narrative, if your project hits on one or more of these needs and benefits criteria, please explain that and touch on that in your narrative and needs and benefits. Okay, completing the grant applications. This is a list of sections you will need to complete, and these are detailed in the application guide. Of course, you start with the standard 424 application, and you must include a site worksheet. This is included on the grants.gov, and there is a link on our website. You will need an executive summary of the project. You will need to address the scoring criteria. You'll need to address the matching requirements. We will need a detailed scope of work, including a budget. You will need to explain the financial information and sustainability. That is, we want the project to continue on its own after the 3-year grant period. You will need a statement of experience of the people working on the project. You need a telecommunication system plan, or TSP as we call it. You will need a list of compliance with other federal statutes, and there is a checklist provided. We'll get to that later. You need evidence of legal authority and existence. We will need the environmental impact and historic preservation. And you'll need consultation with your USDA state director. All of these sections are covered in the application guide in detail. The DLT application checklist is available on the DLT website and should be inserted under Section 1 and signed by an authorized representative. Again, we'll talk about that a little later. Oh, here it is right here, the DLT application checklist. So it goes through all the sections. You can use this to check them off. Section A is the 424 form of worksheet. Section B is the executive summary of the project. And we are asking you to do a summary of what we call a publicly releasable project descriptions, which will be used may be used in news releases or communications. The next one is Section C, which is scoring criteria documentation. C1, economic needs. C1 is reality. C2 is economic needs. C3 is special consideration. And C4 is needs and benefits. Let's see what we got. Then we go over to Section I, which has all the compliance. sections 1 through 10. Some of these you will have to print out a form and sign it and submit it. Some of these, a couple of these just have a form that it's a very simple form, but it does require a signature. It's not as complicated as the first few forms. And then some of these forms don't require you to sign anything, but you are required to read the compliance form. And by signing the checklist, you are stating that you are in agreement or you agree with the language on the compliance forms. This section at the bottom talks about the compliance forms. It says by signing this checklist, you are certifying you understand. By submitting the application, you have enclosed each of the following required documents. So these are documents that you will have to download, fill out, and submit. That's the I-1, I-2, I-4, and I-9 is only required if you are a corporate entity. By signing the certification, you're agreeing to the language in the schedules of I-3, I-5, I-6, I-7, I-8, and I-10, which means you've read those and you agree with what they're saying. To the extent that the certification requires a question to be answered, please address your answer as a narrative attachment to this checklist. I-5 and I-6 have questions that need to be answered. Please attach an explanation to the checklist as to which selections you are making. If you have any questions about your application, please contact RUS prior to submitting the application and certification. So I know this is a little complicated when you first read it, but it's when you go through it a couple of times, it starts to become clearer. And by all means, if you have any questions, please call your local GFR or reach out to RUS and we can help you. Okay, next we go into the worksheets. You have the site worksheet, the Rurality Worksheet, economic need, matching worksheet, special consideration, and budget worksheet. Site worksheet, these worksheets are provided on the website. And if you download and use the worksheets from the website, when you fill out your site worksheet, site name, number name, designation, address, town, county, state, and congressional district, it will pre-populate the other worksheets so that you don't have to type them over. And it's very important that you keep the site number, names, and designation in the correct order on all the site worksheets so we can cross-reference from the Rurality Worksheet and SAPE Worksheet back to the site worksheet. Rurality Worksheet, again, this is where you will enter your census population and your rurality score. Again, this is covered under C1 in the application, section C1 in the application guide. And we give you pretty detailed instructions in the appendix of how to use the census data and to get your population, census population and rurality score. These are the breakdowns. Exceptionally rural, 5,000 less is 30 points. 5,000 to 10,000, 22.5 points. Mid-rural, 10 to 20,000 is 15 points. And remember, you need a minimum of 15 points to be eligible. And urban is over 20,000. Economic need or SAPE worksheet, site number, name, and site designation and county. Again, this should feed over from your site worksheet. This is covered under section C2 in the application guide, and you will be directed to a website where you can get the SAPE percentage poverty all ages from the table, and you will enter that, and you can get your SAPE score for your application. Again, this is all explained in the application guide, and should be, fairly straightforward. And again, if you have any questions, please reach out to your GFR or call DC staff, and someone will be glad to help you. Matching worksheets, again, you must provide a documentation letter for each donor. You are required to do a 15% match. This is the matching requirements are spelled out in the application guide. It's very important that you submit a letter documenting your matching percentage and your dollar amount. And it's very important that on the letter that is submitted to support your match dollar amount, that you include the dollar amount. Please avoid saying, having a letter that says we will donate 15% of whatever the final grant amount is. So we don't want percentages. Please be very clear on exactly the dollar amount that is being pledged, and somebody of authority must sign the matching donation letter. This is the specifics, matching documentation specifics. This is covered under Section D of the application guide. Must be signed by a person capable of obligating the donor amount. The match is in cash. State the dollar amount. Letters without stated cash amount cannot be credited as cash match. So we run into this quite a bit, that people will put in percentages and not actual dollar amounts. If the proposed is in kind, state the actual dollar amount, give a complete description, and it must be new and non-depreciated. So again, the in-kind match this is very specific. There are specific criteria. You're welcome to use in-kind match, but please just follow the rules as spelled out in the application guide. The special consideration worksheet, we ask that you submit this, list the number and the site name as it corresponds to your site worksheet, and we will verify it in the 220 county at-risk counties, and you will get 5 points, up to 30 points, but 5 points for each end-user site that you have in the 220 counties. Budget worksheet. Again, when you do the budget worksheets, these should be separated by end-user sites, hubs, and end-user sites. In other words, list the hub site, list the equipment that's going into the hub site, list the first end-user site, list the equipment that's going into that end-user site, list the second end-user site, list the equipment that's going there. Do not jumble them all together. Like we're going to buy, like you have one hub site and 5 end-user sites. Don't say we're going to use 6 video terminal equipment or 6 particular cameras. Be sure you list the equipment that goes into each hub or end-user site separately. You must have a D&B number. There is a link here if you need to register for Dun & Bradstreet. And it's pretty easy. I'm not sure how long it takes, but it probably takes a couple of weeks. So if you're starting your application now, I would get this, and you don't have one, I would suggest you do this first. SAM.gov, the System for Awards Management Registration. There is a link here to register in SAM.gov. And they claim it might take up to 10 business days. So it's very important that you have an active SAM.gov registration prior to submitting your application, and it must remain current throughout the grant period. It's important that you understand that 2 CFR 200 is the procurement and audit requirements for federal grant recipients. It's the overarching regulations that rules all of our grants, and you should be somewhat familiar with 2 CFR 200. In particular, we call that attention to this part of it that says that contractors that develop or draft specifications, requirements, statements of work, and invitations for bid or request for proposal must be excluded from competing for such procurements. So you can't have a vendor or a contractor write your application for you. And they can't pay someone else to write it, and they can't really even give you somebody for free to write it. If there's any affiliation between the grant writer or the person who writes the grant and the vendor, then that vendor is eliminated from bidding or supplying equipment for this particular grant project. So application submission, you can do this electronically via grants.gov, or you can be postmarked, shipped, and hand-delivered 2 paper copies, with one with original signatures, and we ask that you send a USB flash drive containing your application. Now on grants.gov, I would have to note that there's only the SF-424 on there, so you have to prepare your application offline, and then you will upload your complete application on the box 15 of the SF-424 form. This is the address for the paper applications and the USB flash drive. This is also in the application guide. This is our program website, which has the links to the worksheets, the application guide, some of the specific forms you will need, and it also has this recorded webinar. Any questions? I encourage you to contact the DLT info email address. Most likely, I will be the one answering the email. There are others who answer that, but we do try to respond to those, especially during the grant application window, as quickly as possible, usually same day. So that concludes this webinar. Thank you, and everybody have a good day.